whenever you first see a patient, what are they walking into? And is it different than what they might experience if they go to a traditional therapist or counselor or psychiatric practitioner, anything?
Okay. Answer one. It is different. Depending on the patient, I like to test, not guess. And that's kind of a motto that comes from the functional medicine people. But as an example, you get patients who say every medication has had side effects. Okay, there's testing for that. Let's find out if you have some genetic variant that makes that valid. And then what do we do about it is the secret sauce. True patient example, I had someone in the hospital once, disabling depression, had not worked in years, was about to get divorced, wasn't attending his children's functions, like terrible family distress. We decided to do genetic testing. It came back with a medicine that I had, right hand, I had never prescribed, wouldn't even have thought of. Like, I knew, I'd heard of the medicine, I knew it was FDA approved. I never would have chosen that medicine. I did the genetic testing. I actually did a consult with their service to make sure I understood the what and the why. Prescribed that medicine. Within 3 months, the guy went from being in the hospital to doing intensive outpatient to volunteering at the hospital every day. Like, he was a part-time volunteer. He was attending to his child. His wife came in and was hugging my staff and me, saying this was life-changing. Genetic testing, it's not even expensive. Everybody can do it, but nobody seems to offer it quickly enough. So that's one thing. And then the organic acid test, that one can show some other just kind of dietary things, vitamin issues. There's also a version that does some hormone testing with the organic acids. But long story short, that's another test. It's not crazy expensive. And right off the bat, then we know, what if you don't process vitamin B properly? Well, you need your B vitamins for anxiety disorders. There you go. That was, to me, seems obvious, but that's not the standard of care in most places. But routine labs, absolutely. There's a really simple one, vitamin D. Everybody comes to me and they're like, oh, my vitamin D is fine, especially in Florida. Fine by your primary care standard is a very different number than the mental health standard. So that's another one that's super easy. Insurance even covers it. Your primary care could order it. But if you haven't been trained in the functional side of psychiatry or the integrative piece, you don't know to even look at the vitamin D, because you just look at, is it normal? Normal is just a setting on the dryer. But in mental health, I can improve your depression with some vitamin D. Done.